Hey, this is Dr. Mabrie and our physician assistant Kimberly.
Hi.
And today we want to talk about non-surgical rhinoplasty using fillers, but we want to talk about it in particular after a previous surgical rhinoplasty.
Awesome. So, Dr. Mabrie, can you tell us what is a non-surgical rhinoplasty?
So non-surgical rhinoplasty is using fillers to reshape the nose. And you can use that to either decrease the hump of the nose or you can make the nose look more defined. But instead of going under a surgical procedure, you're doing it here in the office and you're using fillers to contour the nose.
Okay, but you're still able to use it for someone who's had surgery prior.
Yes, you can still do non-surgical rhinoplasty even if a patient has already had a surgical rhinoplasty. In fact, it's a safer alternative, and there are at least 3 reasons that I prefer non-surgical rhinoplasty to surgical rhinoplasty.
And what are those?
Well, one is there's going to be less trauma. If someone's had a surgical rhinoplasty and everything about the nose is good, but you want to just fix a very small portion of the nose, if you're going to fix that surgically, you have to make an incision and elevate most of the skin to get access to that one spot. As opposed to with fillers, you can leave all the good stuff alone and just treat the one area that you want to treat. So a big advantage of non-surgical rhinoplasty is you can have a target approach.
So you can be a little more precise with your results.
Yeah. The second reason is that fillers are great for rebuilding the nose. And a lot of times after surgery, there's been a lot of reduction. You know, the bones have been reduced, some of the cartilage may have been taken away, and fillers are great at building back with a smooth contour because you're injecting. You can almost paint it in a way, in a very precise manner, as you said earlier, predictable. And the third and last thing I like about non-surgical rhinoplasty is that it's reversible. And so again, if you're doing something with surgery where you've put in an implant and you place the implant but it shifts just a little bit, then you have to have a third procedure to go in and try to revise that again. And patients oftentimes don't want to do that. With fillers, if you're placing the filler and you feel like it's a little too wide, or there's maybe a side effect or a complication, you can dissolve the filler right away, and that's a really nice thing to be able to do.
That is nice.
Yeah. Even though I really like fillers, it's important for patients to know that there still are some risks.
So what are the biggest risks?
So for the risk for non-surgical rhinoplasty is injecting into an artery and getting a vascular occlusion. If you happen to inject into an artery, then you're not getting any good blood flow. Now the good thing is there's going to be a sign, we'll see, where the skin's going to turn colors, it will turn blue. So when we see that and you dissolve the filler as soon as possible, then you'll be able to remove the filler, open the blood flow, and then the skin should come back to health.
So it is reversible?
It can be reversible. It's important that you treat it as soon as possible.
Okay.
So in summary, I like to use non-surgical rhinoplasty for patients who've had previous rhinoplasty surgeries. I think it's a great alternative because there's less trauma, less risk. It's great for rebuilding the nose and can be reversible in case there is a complication.
Absolutely. All right, guys, stay tuned.
And stay beautiful.